For our last lesson for the semifinals, we have the lesson 5, health problems common in toddlers. Okay, we'll be discussing first about the burns. Okay, when we talk about burns, these are tissue injuries caused by contact with a dry heat, or it is caused by fire, moist heat, or the hot liquid or steam, and also yung mga chemicals na nakaka-burn, and then electricity, radiation, okay, lightning, and or the extreme cold. Children younger than 2 years old have a greater chance of sustaining burn injuries compared to other children. Okay, we have the classifications here. We have three, the EDS. Okay, first one is the extent of injury. For the extent of injury, it is measured by the percentage of the total body surface area, or what we call the TBSA. Okay, i-measure dito kung ano yung involved dun sa burn, okay, na nangyari dun sa patient, wherein i-compute depende dun sa baseline computation natin sa TBSA. Okay, we have also, itong TBSA din pala natin, this is the assessment of injury to the skin. Yung sinabi ko nga kanina na there is a uh, certain percentage to a certain part of the body. Okay, we have also the depth of the injury. Okay, it is based on the extent of destruction. So superficial partial thickness injury, or what we call the first degree burn. Okay, for the second degree burn naman, this is the partial thickness and deep partial thickness injuries. And last is the third degree burn, where there is a full thickness injury. Okay, for the severity of injury naman, it is determined primarily by the extent and depth of injury, but also yung location, okay, kung saan yung injury. We have the major injury. It requires treatment at a specialized burn unit. So kapag ka major burn na yan, isa special area na siya. Okay, we're in the burn unit. Okay, and kapag ka moderate injury naman, can be treated in hospital. Okay, pwedeng mag-ward na siya. Okay, and also, for the minor injury naman, it can be treated on an outpatient basis. So, sa ER, okay, sa outpatient basis yung treatment niya. Okay, we have the chart here for the burn type. Okay, if either it is minor, moderate, or major. Sa burn type natin, we have the second degree or the partial thickness. Minor siya kapag it is less than 15% of the TBSA sa adult or less than 10% TBSA naman sa child. Okay? Sabihin naman natin siyang moderate, under natin siya ng moderate injury if there is a 15 to 25% for the TBSA sa adult and 10 to 20% TBSA from the child. And then major kapag it is greater than 25% TBSA sa adult and 20% TBSA sa child. Okay? For the third degree or the full thickness burn, minor siya if it is less than 2% of the TBSA sa adult. Okay? And moderate if there is a 2 to 10 TBSA, 2 to 10% of TBSA sa adult, and major injury is yung burn percentage is greater than 10% of the total body surface area. So we will be discussing the etiology sa burn. We have the thermal burns. Okay? For the thermal burns, ang nagkakos dito is mga fire, okay, hot surface, and hot liquids. Okay? Next one is the electrical burn. For the electrical burn, siyempre ang source ng burn niya is source of electricity. Okay? For example, yung mga household currents or yung lightning. Under yan ang electrical burn. For the chemical burns, there is a cause of acid, alkali, or organic compounds. Man lahat ng mga chemicals na pwedeng makasunog ng balat. Okay? Or makaburn. Okay, radiation burn. We have the sunlight. Okay, sunlight exposure, mga like the sunburn. Yan. And also mga medical therapies. Okay, radiation burns is yung mga medications na ginagamit. Like for example, sa mga cancer patients. Okay. And the next one is child abuse. So, under din po siya ng burn natin, isang etiology wherein nagkakaroon ng immersion burns and contact burns like yung pagpaso ng cigarette, okay, or yung sa yosi. Okay, for the pathophysiology, We have sa local damage, it depends on the degree of the burn. So we have the first degree, second degree, and then the third degree. And sa second degree natin, we have to about the partial thickness or the deep partial thickness. Okay, first one is the first degree burn, or what we call the superficial partial thickness. Okay, it results in destruction of the epidermis. When we talk about the epidermis, it is the first layer or the outer layer of the skin. Okay, and also physiologic function remain intact and tissue damage is minimal. Okay, the damaged epithelium peels off in about 5 to 10 days without scarring. Okay, and then dito, dagdag ko lang din, the burn site is red, painful, and dry, and has no blister. Okay, wala siyang blister. Yung blister na tinatawag natin, yun yung, alam yung parang magtutubig siya. Yun. Okay, so wala siyang ganun kapag first degree. Okay, for the second degree burn, we have the partial thickness. Sa partial thickness natin, injuries result in destruction of the epidermis and some of the dermis. Okay, sa dermis natin, di ba yung epidermis, sabi natin kanina, the first layer. Pero meron na siyang involvement ng dermis, which is the middle layer of the skin. Okay, it has ang mga laman ng middle layer natin, it has a connective tissue, mga blood vessel, okay, mga sweat glands, and also nerves and mga hair follicles. Okay, the capillary damage occurs for the partial thickness. And this type of burn usually heals spontaneously in about 14 days, and the scarring is very minimal. Okay. Next one is the deep partial thickness. Okay, injuries result in destruction, okay, of the epidermis and also the dermis. Okay, heals more slowly, okay, by regeneration from the epithelial lining of skin appendages, sweat glands, and hair follicles. It requires months to heal and scarring is common sa deep partial thickness natin under ng second degree burn. Okay? Edema also resulting in compartment syndrome. So that is under the second degree burn. Next one is the third degree burn. Okay, result in destruction of the epidermis. Aside from epidermis, there is a dermis and yung mga underlying tissues sa baba, which may include the fascia, okay? The fascia, muscle, tendon, and the bone. Okay, when we talk about the fascia, this is the thin casing of connective tissue that surrounds and holds every organ. Okay, sa mga blood vessels, sa bones, sa nerve, okay, nerve fibers, and sa muscles in place. Okay, will not heal without treatment and requires skin grafting. Okay, and autograft, okay, scarring can be minimized by early excision and grafting. Okay, yun yung kukuha sila ng ibang skin sa ibang part ng body, itatapal doon sa area na doon sa nagkaroon ng burn. Okay, that is the skin grafting. Okay, we have the systemic damage. Okay, for the systemic damage, severe burns can cause a systemic damage. We have the respiratory compromise. Okay, for the respiratory compromise, inhalation injury leads to swelling in the tissues of the throat, okay, na inhale, okay, and upper way within minutes of injury. Okay, there is a edema, okay, it remains for 2 to 5 days. Okay. And also sa burn shock natin, this is a kakaroon ng hypovolemic shock, okay, can occur when burns affect more than 15% to 20% of the TBSA due to the massive capillary leakage. Okay, when we talk about hypovolemic shock, it is an emergency condition in which severe blood or other fluid loss makes the heart unable to pump enough blood to the body. Okay, next one is the growth retardation. Growth hormones levels are nasusuppress. Okay, so isang systemic damage yan ng burn. Okay, next one is the accelerated metabolic rate. Okay, for this one, energy expenditure increases from 40% to 100% above the basal levels associated with the increase in catecholamine levels. Okay, when we talk about the catecholamine levels, it is important in stress responses. If increase can cause hypertension, sweating, pounding of heart, anxiety, and also pain in the chest. Okay, so next is aside from the increase in increase in catecholamine level, there is also a hyperglycemia, and also the increased nutritional needs. Okay, next one is the local infection of sepsis. Burns create moist and warm environment for bacteria, including the body's own flora. Okay, gram-positive organisms such as the Staphylococcus and gram-negative organism, particularly Pseudomonas aeruginosa, colonized by the third day. Okay, for the nursing process natin, we have the assessment findings. Okay, for the assessment findings, for the clinical manifestations, we have the first degree burn. There is a dry skin area, red skin color, minimal to no edema. So, pwede magkaroon ng edema pero sobrang minimal lang siya. Hindi naman siya yung ganong ka-severe. Okay, blisters that appears after 24 hours. So, pwedeng wala, pwedeng hindi. Okay, so after 24 hours, possible siyang magkaroon ng blister. Okay, and also pain and touch sensitivity. For the second degree burn, for the partial thickness, there is a moist skin surface, red to pale ivory skin color, and there is an edema, okay, namamaga, and the blisters that form within the minutes and are thin-walled and fluid-filled to moderate pain. Okay, for the deep partial thickness, ano yung clinical manifestation natin? Dry skin surface, okay, mottled, waxy white skin color, and there is also a edema, and flat dehydrated and tissue paper like blisters as common, fluid-filled blisters possible, and moderate pain with severe pain on exposure to air or water. So for the third degree burn, ang clinical manifestation is dry leathery skin surface, okay? Cherry red, white, or black skin color, and there is an edema. Okay, yung blister rare naman siya, and there is no pain in area burn. Okay, very painful surrounding areas. So, sa burn, okay, wala. So, pero sa surrounding niya, meron. Okay? Sa classifications natin, we have the minor, moderate, and severe. Okay? For the minor muna, we have the first degree burns or the second degree burns less than the 10% of TBSA or the total body surface area. Third degree burn, okay, less than 2% of the TBSA. And no burn on face, feet, hands, or genitalia. Yan yung under ng minor injury. Okay, for the moderate naman, there is a second degree burn, okay, which has a 10% to 20% of the TBSA. And there is a burn on face, feet, hands, or genitalia. And there is a third degree burn, 3% to 10% TBSA. Occurrence with smoke inhalation also. Okay, for the severe naman, second degree burns greater than 20% TBSA, and third degree burn greater than the 10% TBSA. Okay, for the laboratory diagnostic study findings, okay, we have the fasting blood sugars elevated due to the altered glucose metabolism. Okay, and also there is a complete blood cell count reveals initial evaluation initial elevation of the hematocrit from the hemo concentration. Okay, we'll talk about the hematocrit. This is the percentage of the volume of the blood, of the whole blood, that is made up of RBC. In burns, the patient has lost a lot of fluid from leaky blood vessels. Blood, ano, okay. Okay, next is the electrolyte studies will reveal hematuria, which is caused by a sodium shift from the intravascular to the interstitial spaces, and also there is a hyperkalemia, okay, which is caused by cells lysis. Okay, pag sinabi kasi nating lysis, ito yung breakdown ng cells. And ABG studies will indicate metabolic acidosis due to the hypovolemia and the cell damage. So for our nursing diagnosis sa burn, there is an ineffective tissue perfusion. Syempre, there is a lack there is a lack oxygenated blood flow na papunta doon sa area. Okay? There is also a risk for infection due to the loss of skin barrier, 'di ba? Ang skin natin, that is the first line of defense natin. Okay, next is the impaired skin integrity. Okay, dahil nako-compromise yung skin layer due to the damage. Okay, acute pain. Okay, because of the nerve endings na meron sa ating dermis. Okay, next one natin is the risk for imbalanced nutrition or risk for imbalanced fluid volume due to the dehydration. Okay. Next is the ineffective thermoregulation. This is due to the burn. Due to the burn, it leads directly to the loss of its function, resulting in an alteration in the thermoregulation. And also, there is a disturbed body image and interrupted family processes, and also the imbalanced nutrition less than the body requirement. So that is the nursing diagnosis for our burn. Okay, we will be discussing naman sa care of major burns muna. Okay, for the care of the major burns, assess for signs of respiratory distress. Okay, burn shock and also fluid and electrolyte imbalance, and check also for the altered metabolism and infection. Okay, assess for signs of vascular heat loss like the coolness or the acrocyanosis or the mottling. Okay, pag sinabi nating acrocyanosis, this is the sa peripheral, okay, peripheral arterial disease, which is either is a persistent painless bluish discoloration of the both hands and less commonly of both feet, caused by spasm of small blood vessels within the skin, usually in response to cold or emotional stress. Okay, next is the mottling. Yung sabi nga natin, ito yung bluish to red, okay, or lace-like pattern. Yung sa may, sa skin nakikita. Okay? Next is the administer prescribed medications like the tetanus prophylaxis, okay, and then topical or the IV antimicrobials and antibiotics and also analgesic, okay, and then there is also a antipyretic and soothing lotions and the vitamin A, B, and C and iron, zinc, and also the antipyretic. Okay. Next one is the promote optimal circulation to distal regions of the affected area. Okay, monitor for signs of compression, ano pa, which are numbness, tingling, color changes, and the temperature changes. And then there is a assess determined pulses or and the prolonged capillary refill. Next is the prevent. It prevent also the infection and promote wound healing. Okay, this is the maintain infection control procedure and our precaution, and this is to debride the scar, crust, and the blisters. Okay, and maintain the integrity of the skin graft, maintain the split and the dressing, and also reduce the pain. Maintain an adequate hydration status. Uh, monitor daily weights and fluid intake and output. Next is the maintain normal thermoregulation. Okay, this is to minimize the chilling or the shivering. And then sa promote optimal nutrition natin, we have the high calorie, high protein, and then record the child's food intake. And we should encourage optimal physical functionings, okay, and minimize scarring. We have to conduct range of motion exercises, exercise disability, exercise or encourage mobility, splint the joints in extension when sleeping to prevent contractures and also encourage self-help, and wrap healing tissue with elastic bandage to minimize the scarring. And also we should provide emotional support to child and family and prepare the child and family for discharge, like teach about the wound care and discuss the diet and rest activity and reinforce the need for the follow-up care ng patient. Okay? Next will be the poisoning. Okay? Okay, sa poisoning, we have the lead poisoning or the plumbism, one of the most common pediatric problem in the US, result from inhaling or ingesting the lead-containing substances, which ay sa example natin sa lead is yung mga lead-based paint, contaminated soil, yung mga children's toy, and then yung mga imported na candy. Okay? And then this result from inhaling and ingesting lead containing substances. Okay, sa highest incidence natin, okay, sa late infancy or the age of 6 to 12 months and also to toddlerhood, which is nasa 2 to 3 years old. Okay? Sa theology natin, the child can be positioned in three ways. Okay, we have the eating contaminated food, okay, or non-food substances. Saan pa siya pwedeng ma-poison? Like the breathing contaminated air and then yung drinking yung contaminated air. Okay? Sa pathophysiology natin, lead which is very slow excreted through the kidneys, GIT and slightly through sweat is stored chiefly in the bone. Okay, when the rate of absorption surpasses the rate of excretion, lead is deposited into the soft tissues of the body and bone and attach itself to the RBC, which interferes with the production of the heme and the formation of hemoglobin, which results in the microcytic hypochromic anemia. Okay? Okay, pag sinabi natin micro, okay, micro, letter I yan, micro. Okay, pag sa micro, smaller size of the RBC. Kapag hypochromic naman, decrease ang kanilang red color. Okay, so for this one, the microcytic hypochromic anemia, body has low levels of RBC that are both smaller and paler than normal. Okay, okay, lead affects the kidneys by alternating the permeability of the proximal tubules, resulting in increased urinary examination of glucose and protein, and also lead deposits also increase vascular permeability, resulting in a fluid shift and lead to encephalopathy and increase in ICP. When we talk about the encephalopathy, ito yung any diseases of the brain that alters brain function or the structure. Okay, sa ating increased ICP naman, ito yung pressure dun sa brain. Okay, and then likely due to an excess of fluid. So, that's sa ano natin. So, next na natin is the assessment finding. Okay, for the assessment finding natin, okay, associated finding, we have a history of PICA may be determined. Okay, sa PICA na to, ito yung eating disorder in which person eats things that usually considered food like yung mga grass, mga laruan, di ba? Hindi naman considered food pero kinakain. Okay, clinical manifestation, we have the hematologic. Sa hematologic, there is a signs of anemia. Ito yung parang feeling cold and tired. And also renal. Okay, sa renal naman, there is a glycosuria, ketonuria, proteinuria, and hyperphosphatemia. Itong mga to, it leads i-affect in the kidney. Okay? Sa GI naman, acute crampy abdominal pain, vomiting, constipation, and anorexia. Okay, sa musculoskeletal naman, there is a short stature and lead lines in bones on X-ray films. And sa neurologic, we have the low dose and then the high dose lead exposure. Okay, sa low dose naman, uh, behavior changes such as the distractibility, hyperactive impulsibility, learning problems, hearing impairment, and mild intellectual deficit. And then sa high dose, okay, there is a lead encephalopathy. Okay, lead encephalopathy, this is the most serious consequence of an acute or chronic lead poisoning in adults and also sa children. Okay, which is manifested by seizure, mental retardation, paralysis, blindness, coma, and the death. Okay, laboratory and diagnostic study findings, we have the lead test. Okay, for the lead test, this serum lead level exceeding 10 mcg per DL, or what we call the positive for lead poisoning. For the nursing management, we have to monitor the child for manifestations of the lead toxicity. Okay? Ito yung mga like the stomach pain, headache, vomiting. There's also confusion, muscle weakness, and seizure, and then hair loss and also anemia. Okay, so yan yung mga manifestations for lead toxicity. Okay, administer the chelation therapy as prescribed. When we talk about the chelation, ito yung mga meds given by mouth to binds with the lead so that it's excreted in the urine. Okay, so magbabind siya dun sa lead para mailabas natin. Okay, we have the Soximer or the Chemet. Administer to orally, can be open and sprinkled on food. The adverse reactions are nausea and vomiting, diarrhea, elevated ang kanilang liver enzyme, okay, and then neutropenia. Another one is the dimercaprol. Okay, do not give to children who are allergic to peanuts or those who have with T6PD or the glucose 6 phosphate dehydrogenase deficiency, wherein that is a genetic disorder that affects the red blood cell which carry oxygen from the lungs to the tissues throughout the body, and it causes the RBCs to break down prematurely. Okay. So it is start iron therapy at least 24 hours after the dimer-caprol administration finish. Okay, the medication forms a toxic compound with iron. Okay, so next is the editate calcium disodium. Carefully monitor the renal functioning because of there's appearance of sediments in urine. May significant there may be a signal for a renal failure, and also give medications by IV route, okay, administered with a procaine of given IM, or what we call when we talk about procaine is a local anesthetic drug. Okay, and then monitor for side effects like the nephrotoxicity, okay, toxic na siya sa kidney, and headache, anorexia, vomiting, elevated ang liver function test and ECG changes. Nagbabago. And next is encourage fluids to enhance the lead excretion para may ihi niya. And then monitor fluid and INO or the intake and output and evaluate the kidney function. Okay? And then monitor the fluid and INO. O yun na yun. And then next is the prepare a child and family for interventions. Okay? Which may vary according to the lead level scores. So, ito yung mga may baseline. Okay? And then, ito yung mga procedure na gagawin. Okay? Next is perform prescribe serial urine testing during the chelation therapy to monitor the kidney status and also yung rate and volume ng lead na ina-excrete. Okay? So, that's all for the poisoning. Okay? Next one is the okay. Okay. Next is the child abuse na topic natin. Ito na yung pinaka last na natin, child abuse. Okay? Ay, meron pa pala, cerebral palsy. So, second to the last. Okay, for this child abuse, it used to describe acts of commission or there is omission by caregivers that prevent child from actualizing his or her potential growth and development. Okay, we have the type. We have the physical abuse. Pag physical, there is an intentional infliction of injury. Okay? To a child. So, there is a physical abuse, binubugbog, ganyan. Okay? So, there is a contact. Okay? Emotional abuse. Okay? The deliberate attempt to destroy the child's self-esteem or competence. Like, for example, lagi siyang sinasabihan, ang baba mo, mga ganon. Okay? So, there is a emotional impact sa bata. Okay? And sa neglect naman, okay, ito yung can be physical or emotional. Okay, ito yung nade-deprive or nafo-forget, nakakalimutan or nadi-disregard yung kailangan ng bata or yung bata mismo. Okay, like the physical neglect, emotional neglect. When we talk about the physical neglect, ito yung deprivation of necessities such as food and shelter. Okay? And sa emotional naman, there is a failure to meet the child's need for attention dahil sa sobrang busy. And then, affection and emotion nurturing. So, under pa rin siya ng child abuse, under ng emotional neglect. Okay? Next is the sexual abuse. There is a presence of contact, okay, or interaction between a child and an adult when the child is used for sexual stimulation on a sexual stimulation of an adult. Okay? For the etiology, ano yung mga parental factors natin sa child abuse? Yung may severe punishment of parents when they were children. Okay? So, parang naipapasa. Okay? Poor impulse control, wherein the person has trouble controlling his or her emotions or behavior. And then free expression of violence, and social isolation, and yung mga merong poor social emotional support system, and then mababang kanilang low self-esteem, mga parents, and there is a history of cruelty to animal. Okay? For the child naman, ano yung mga factors ng child? Yung kanilang temperament, okay, or yung mga components of their personality. Okay? Temperament. Okay, next is the illness, yung disability, developmental delay also, nagiging cause. And then, illegitimate, illegitimate, illegitimate or unwanted pregnancy. Okay, illegitimate or the unwanted pregnancy. And then hyperkinesis, wherein there is an increase or uncontrolled activity. Yung mga overactivity ng muscle, muscular movement. Okay, and then resemblance, I know, uh, next natin is yung sa failure to drive. Okay, failure to bond. And then resemblance to someone the parent does not like. Okay, yung pag sinabi ng resemblance, ito yung being alike. Okay, parang ginagaya mo or nagiging kamukha mo yung ayaw na ayaw ng magulang mo. Okay, so there is a factor. And then next is the environmental factors. Okay, we have the chronic stress, poverty, poor housing and unemployment, and also sa divorce and the frequent relocation, palipat-lipat sila. Okay, next is the factors specific to sexual abuse. The abuser is typically a male whom the victim knows, and offenders come from all socioeconomic levels, and then the father-daughter and the stepdaughter incestuous relationship. Wherein, pag sinabi kasi natin incestuous, one involving sexual intercourse between the two members at the same time. Okay? So, next, nursing process natin. For the assessment finding, for the clinical manifestation, we have the child abuse. Actually, the physical abuse. Yes, assessment finding, clinical manifestation, physical abuse. Okay, for the physical indicators, include the cutaneous injuries or the skin injury, like example, the different stages of bruises in odd locations, mga burns like the cigarette marks. Okay, we have also fractures, head injuries, okay, eye injuries, mouth injuries, poisoning, drowning, or the repetitive accident. Okay, behavioral indicators include the awareness of adult, fear of parents, suffer pain without crying, afraid to go home, okay, superficial relationship, overly friendly, reports injury by parents, or exhibit attention-seeking behavior. So that's all about the manifestation of the physical abuse. Next is the emotional abuse, wherein the physical indicators include failure to thrive, okay, developmental lags, feeding problem, enuresis, and the sleep problem. Pag sinabi natin enuresis, there is a loss of the bladder control. Okay? Next is the behavioral indications include habits, okay, madami dyan, and age-related behaviors or attempted suicide. Okay, next is the neglect. Physical indicators include family to thrive, manipulation, constant hunger, poor hygiene, inappropriate clothing. There is a bald patches on infant or the hair loss due to the friction. Okay, nawawalan ng buhok. Okay, and then lack of adequate supervision, abandonment, or poor ang health, okay, poor ang healthcare. Behavioral indicators include dull inactive infants, and then mm, begging or stealing food, okay, school attendance problem, and then drug and alcohol abuse or the delinquency. Okay, next natin is the sexual abuse. Okay. For the sexual abuse naman, in many cases, there are no overt signs or there is not shown. Okay, not shown na sign. Ito ba natin? Ayan. There is are no overt signs of sexual abuse. Okay. Possible physical indicators include the difficulty walking or sitting, and aside from that one, torn, strained, and bloody undergarments or undercloth, growth evidence of trauma in the genital, oral, okay, anal regions, okay, and also there is a pain, itching, or the sexually transmitted disease, and then sa genital discharges, pregnancy, weight loss, and eating disorder, or vague somatic problems. Okay? So, uh, or complaints. Okay? Next is the behavioral indicators na yan. I-ano na yan. Okay, for the nursing diagnosis, we have the risk for injury, fear, anxiety, risk for post-trauma syndrome, altered parenting. Sa planning, the child will experience no further harm or neglect. Okay, syempre, the child will experience a reduction of in fear and anxiety. The parents will exhibit a positive interactions with the child. So that is the planning. For the implementation, we have, syempre, protect the child from injury or neglect. Yun naman talaga, di ba? And minimize the child's fear and anxiety. Yun yung mga gagawin. And foster positive parenting. Okay? Okay, next one is the evaluation natin. Okay, the child remains free of harm and is not neglected, dapat. The child experiences less fear and anxiety, and the parents demonstrate positive interactions with the child. So that's all for the child abuse. And then lastly is the cerebral palsy. Okay, for the cerebral palsy, this is a group of disability caused by injury to the brain, either before or during the birth, or pwede din naman in the early infancy. Okay, so the most common permanent disability of childhood. Okay, for the classifications natin. Okay, for the classifications. Okay, we have the spastic cerebral palsy. It is a most common type and may involve one or more sides of the body. Okay, there is a clinical hallmark including the hypertonicity with a poor control of the posture, ano pa, balance, coordinated movement, and impairment of fine and gross motor skills. Active attempts at a motion increased the abnormal postures and led to overflow of movement to the other parts of the body. We have the common type here. We have the hemiparesis, quadriparesis, and diplegia. Okay, the hemiparesis, one side of the body is affected. Okay, and then sa quadriparesis naman, all fours of the extremities are affected. And the diplegia, similar body part are affected such as both arms. So that is the types of this spastic. So next one is the dyskinetic or the athetoid. Okay, this is a type involve of normal involuntary movement that disappear during sleep and increase with the stress. So may ganun pala, no? Nag-i-stop siya kapag nagre-rest, and then nag-aatake na naman siya once na nag increase yung stress. So, okay. So, next one is the ataxic. Ataxic is the manifested by a wide base gait, rapid repetitive movement. Okay. And then Repetitive movement performed poorly, and disintegration of movements of the upper extremities when the child reach the object. So, that is the ataxic. Ito yung may kapag naglalakad yung malawak yung gap or yung distance ng dalawang paa nila. Okay, next is the mix or the dystonic. Okay, this type of manifestation by a combination of the characteristic of uh, spastic and athetoid cerebral palsy. So, for the etiology, we have the cerebral palsy commonly results from existing prenatal brain involvement. So, isang ano din yan. Okay, next is sa ating pathophysiology. Okay, for the pathophysiology, disabilities usually result from injury to the cerebellum, the basal ganglia, or the motor cortex. It is difficult to establish the precise location of neurologic lesions because there is no typical pathologic picture. In some cases, okay, the brain has gross malformations, okay. In others, vascular occlusion, atrophy, loss of neurons, and then degeneration may be uh, okay, may be evident. Okay, and cerebral palsy is non-progressive but may become more apparent as the child grows older. So, sir, as assessment findings, okay, for the assessment finding, okay. Assessment finding, the most common clinical manifestation in all types of cerebral palsy is delayed growth ang kanilang motor development. So, we have the, sa delayed ang gross motor development, okay, children who have not been, okay, may not be or has difficulty rolling, okay, crawling, sitting, and walking. So, sila yung may problema sa pagro-roll, okay, sitting, and walking. Okay, nagkakaroon sila ng difficulty. Okay? Okay, next is the additional manifestations include the abnormal motor performance. Aside from that one, alterations sa kanilang muscle tone and abnormal posture and also sa reflex abnormalities. Okay? Next is the disability. Okay. Disabilities associated with the cerebral palsy include mental retardation, seizure, attention, and deficit disorder, and sensory impairment. And severe cases may be observed at birth. Okay. Mild to moderate cases usually are not detected until the child is 1 to 2 years old. Okay. Failure to achieve milestone may be the first sign. Okay. And okay. For the diagnosis, okay, it is based on the following: the prenatal, okay, prenatal, birth, and postnatal history, and also okay, neurologic examination, assessment of muscle tone, behavior, and abilities, and also other disorders such as the metabolic disorder, degenerative disorders, and early slow-growing brain tumors are ruled out. Okay, in all infants should receive a periodic developmental evaluation, especially those who are at risk. Okay, for the nursing management, yan. Okay. Prevent physical injury, ano pa? Prevent physical deformity, promote ang kanilang mobility, okay? Promote ang adequate fluid and nutritional intake, and then yung foster, okay? Foster relaxation and general health by providing a rest period, ano pa? Administer prescribed medications, and then encourage self-care also, okay? And facilitate communication, okay? Uh, facilitate communication, and then yung seek referral for corrective lenses and hearing devices. Okay, to decrease the sensory deprivation related to the vision and hearing losses. And also, it help promote a positive self-image in the child and promote optimal health, optimal family functioning. So, yan yung nursing management. Okay. So, ano pa? May ano pa tayo, dagdag pa na isa dito eh. Number 12. Okay. Ito. Uh, for the prepare also the child and family for procedures, okay, kung ano yung mga gagawin, procedures, and also if there is a treatment and surgeries if kailangan ng bata. Okay, so that's all for the last na lesson natin, lesson 5 for the semifinals. Thank you.